The medicine in the pressurized canister of the MDI sprays at 80 to 100 miles per hour, and regardless of how well you inhale, the medication hits the back of the mouth and it is wasted without getting into your lungs. For this reason, it's recommended MDIs are used with a spacer or sprayed from a distance of 2 fingers away from the mouth. If a spacer cannot be used by sealing your teeth and mouth over the mouthpiece, typically for the very young and the very old with no teeth or few teeth, a spacer with a mask gently pressed around the nose and mouth is recommended. How to use your MDI with spacer. Sit or stand up straight. Remove the cap from the mouthpiece of the spacer and inhaler. Check for and remove any lint or objects in your inhaler and spacer. Hold your MDI with your index finger on the top of the canister and your thumb under the canister holder, called the boot. If you are using your inhaler for the first time or haven't used it within 48 hours, prime your medicine. You can do this by turning the mouthpiece away from you and spraying once or as many times as is recommended, found in your medication instruction and information. Shake your MDI for 5 seconds to mix your medication in the pressurized canister. Place the MDI mouthpiece into the rubber end of your spacer. Turn your head away and exhale slowly, completely, remaining comfortably. Place the mouthpiece of your spacer between your teeth and seal your lips gently around it with no gaps and not biting down. With your head tilted back slightly, firmly press down on the canister, squeezing it between your index finger and thumb. Inhale slowly and completely until your lungs are full. Hold your breath for 10 seconds, or if unable, as long as you can. If you have small, shallow breaths, you can take 3 or 4 in and out of the spacer, holding for as long as you can between the breaths. Remove the spacer from your mouth and exhale slowly. Replace the cap of the mouthpiece of your inhaler and spacer to keep it clean. If you need a second dose of medicine, wait 30 seconds and shake your inhaler and repeat from that step.